welcome. My name is Terry Maroney. I'm the OR director here at Texas Health Fort Worth, and I'm about to take you on a tour of our current state of what our ORs are right now. This is what we work with right now. It's right around the 400 square foot mark. We do a lot of general laparoscopic cases in here, GYN laparoscopic cases in here. We do open cases, ENT. A lot of different service lines will fit in this little room here. So this kind of gives you a current state of where we're at. Very efficient room, something that we do a lot of cases in, but now that we can go across here, we'll show you what our future looks like. It's like walking into a different reality. This room right here is roughly 950 square foot, put on our existing footprint that we had here. Room will be a little bit different, but not by much on what would be rebuilt on the other side. So many advantages of having size on your side, right? One of the biggest pieces right now is the complexity of procedures. A lot of our procedures that we're doing now is requiring more equipment. Some equipment's getting smaller, but there's a lot of equipment out there that's getting bigger, especially when you get into involved with polytraumas and other stuff like that we do very much on this side, where you're looking at 2 different C-arms coming in, or if you're doing a big neuro case and you have an O-arm coming in, you have to have that size in that room to be able to safely operate on these patients. The fact that we're in the process of going to a level 1 trauma center and becoming an education facility, you're gonna have additional people coming to that piece too, that we wanna be able to formally train them. We wanna be able to have the room and the space to be able to welcome that in here. So huge piece to our education here is to have the size and ability to be able to do and show these cases and do them appropriately. Because again, our ultimate concern is gonna be the patient on the table. The internal environment in here makes you think differently, makes you feel differently. And when you come in here, you see technology, you see improvement. From my staff alone, working in this room on the emotional level, you understand the difference of what this room makes, how you want to perform. A lot of pieces about this room on what makes it so much better than what we have right now. And first and foremost is the stainless steel walls. I've got these panels, they're detachable panels. So if I have a issue with the electrical and I have to get access to the back to where the wiring runs through to one of these monitors or whatnot, all you have to do is takes 10 minutes to pop one of these panels off, get back in there, do your repair, and then pop that panel right back on. You know, it could have been a 3-week job, has now been done in an hour. Again, when we're building these ORs, we're not building these ORs to reenact what we have right now. We're building these ORs to be around for the next 30 years. And we want to be able to evolve and really change the transition of what surgery is. It's something that you can keep growing with it, keep taking the next step and making sure that you're not maximized at 5 years of what you can do. These screens right here are used just for video purposes. We can put anything up on any screen in this room that we want. So you've got vantage points on both these screens that you can see. And then on top of that, we've also got the large monitors that are hanging from the ceiling on these booms. This camera head this videotapes wherever you put the light at, and it can record the procedure. And if you're not recording the procedure, at least gives you a vantage point of what's going on. By building this area here in this room, this is how I can convert it to one type of case to another. In the new build, there'll be instruments all on this rack right here. So the minute that you need something, all you gotta do is come over here, open it up, grab what you need, and close it. When you're finished with the case, and we're going from a neuro case to an orthopedic case, there's doors on the back side that you can open up. You maintain your sterile area, you maintain your sterile core. They just roll straight out, and you roll your orthopedic stuff in. As we are rotating around here, we have our buzz from Brain Lab. This is a piece of our OR integration. Talking from one room to the next, having that communication within the hospital, but we don't have to be face to face. We can still communicate from one unit to the next by staying in the room. We have any ability to do anything here right now. When we build this OR to be your universal spot for surgery. And it's not just your basic surgery. What we want to do is we want to challenge the complexity. We don't get you just with the technology, but we're going to hit it up with processes, safety measures. So Harris Fort Worth is not only going to be where you go have the coolest surgeries, but you're going to have the safest surgery. You're going to have the most efficient surgery, cost-effective surgery. We're going to be hitting it on all different lines. We're constantly working on stuff to improve the foreseeable future. We're really breaking down all aspects of what surgery is and how to take it to the next level. Right here is your standard CT that you would get. It's automatically uploaded in our program here. When a surgeon walks into our room, all the images that you had on this patient and that you want on this patient will be here at your fingertips. So you have your standard, views right here. It's all touch screen. So you have your MRIs. You can see right there, it's building the anatomical map in a 3D surface based upon what the MRI results gave. You can turn it and look at it. You can check the sizes and diameters and get cuts of everything that you need. Imagine a surgeon having this at their fingertips to be able to pre-plan a surgery. If you've got a difficult tumor or anything like that that you really want to have the specifics on, you have the ability to take it, take all your images, put them together on here, and this program will sit there and correlate it and design the size and really give you an idea of what you're looking for and come in with a plan. We want to use 100% of the capacity of what our integration can do and really take it to places that you haven't seen surgery go before. Having the ability to be able to develop this and really work with fantastic crews on trying to capture every piece of what is going to be involved to be successful with a new build, with the Justin Tower, on how it's going to affect our community. But it doesn't just affect our community. It affects our staff. It affects the people working with it. You can get all the cool devices that you want, but to have that ability to be a part of something that's going to affect your community at this level is exciting.